I'm in conversation with Dr. Ashok Seth. Dr. Ashok Seth is a physician par excellence, a Padma Shri, a Padma Bhushan, and a recipient of the prestigious B.C. Roy National Award. He's the head of cardiology and the chairman of the Fortis-Escorts Heart Institute in New Delhi. I think it would be fair to say that Dr. Seth is synonymous for cardiology in India. And actually, he's a brand in himself and a rather sought after one at that. Welcome, Dr. Seth.
Thank you,
Lovely to have you on board.
Thank you. Pleasure meeting you. Pleasure talking to you.
There are three qualities about Dr. Seth I particularly admire. One, his attention to detail. He will never rush his patients. Second, his holistic approach. He's not just looking at the heart, but he also looks at other underlying conditions like the kidneys, the liver, gastro when necessary, and of course diabetes. The third one is my favorite. He's old school and he follows a conservative line of treatment, especially with the elderly. The topic for our conversation today is why are young people in their 40s, early 50s having heart attacks? And more important, when they do, why don't they make it? So, thank you again. I would like to make a start, Dr. Seth, by asking, what is the difference between a heart attack and a cardiac arrest? Often used interchangeably. And which one is more fatal if not treated immediately?
I think, Triveni, you started off with a very important question. And this perhaps the whole country gets confused about. And so does media. And in fact, people don't understand the difference.
Right.
You're right, they use it interchangeably. A cardiac arrest is a situation where the heart stops.
Okay.
And it stops for multiple reasons. But when it stops, literally life is going away. And if the person is not resuscitated or brought about, in the next few minutes, it would be death.
Right. Okay.
So it's clearly a condition which would lead to death unless resuscitated. On the other hand, a heart attack is a condition where an artery of the heart gets blocked. The patient experiences chest discomfort. The patient experiences sweating, ghabrahat, nausea, vomiting, and severe crushing pain down to both arms, but is still conscious and can get to the hospital and get a treatment done. So heart attack and cardiac arrest are two. Now, in the adults, one of the commonest cause of cardiac arrest, which means heart stopping suddenly, is a heart attack.
Okay.
So heart attack in 10% of the patients would present as a cardiac arrest.
Okay.
But heart attack doesn't necessarily mean a patient has collapsed.
Right. Okay.
Cardiac arrest, in the adults, like I said, the commonest cause is a heart attack. But when you see young people having a cardiac arrest and collapsing, or a child collapsing, that's not a heart attack.
Okay.
That could be congenital abnormalities of the heart. That could be rhythm disturbances of the heart. Even a stroke or even a bleed in the brain would cause the heart to stop. A lung condition can cause a heart to stop.
Right.
And certain hereditary disorders also of the heart can have a heart to stop. So what is sometimes not correct is if a 13-year-old child collapses to call it a heart attack.
Right.
If a 25-year-old has collapsed, it may not be a heart attack. If a soccer player who exercises every day collapses, it may not be a heart attack. It could be a congenital condition. It could be a hereditary genetic disorder. And of course, on some occasions, it's really a heart attack.
Thank you. That's really, really informative because you're right. I mean, all of us just use it all the time and we think, well, it's the same thing. Now the important question, why are so many people in their 40s and 50s having heart attacks? You know, it beats me because there's access to so much these days in terms of health facilities, education, awareness. Despite that, often I see gymmers, they're having heart attacks.
Right.
What is your view?
Yes, so that's a very important question. We must remember that heart disease in the young people has increased immensely over the last 15 years. It's gone by 300%. And that's because it's a lifestyle disorder.
Right.
Blockages in the arteries of the heart, which cause heart attack, are due to, we know the risk factors. And the risk factors, of course, apart from family history, which is being passed down the family. And what we mean by family history is somebody at the age of parents less than 60 have had a heart attack or a heart disease or had been treatment for angina, stents, etc., bypass. That means that the family predisposition is there for a heart problem. Now, add to that our lifestyle, which are smoking, the worst risk factor for having a heart disease. Associated with that is diabetes and high blood pressure. The incidence of diabetes and high blood pressure have doubled in the last 15 years. Add to that obesity, which is being overweight. That actually is a very bad risk factor, which also increases cholesterol. And therefore, that's another important risk factor which brings in. And then we have obviously the other things, because lack of exercise is a very important risk factor in the present moment. Add to that, we have increased alcohol intake, stress, COVID, and pollution.
Right.
So in the recent times, I believe most of our young people have been affected with an increase in heart disease, and we keep calling it lifestyle disorder. They eat badly, they eat all forms of stuff, they don't understand, and they exercise least, etc., and they're all overweight. No, it's not just that. They are unfortunately being subjected or exposed to pollution, and that perhaps has been one of the biggest risk factors in recent times for the increase of heart disease.
Oh, wow.
Now, you asked me the question.
Yeah.
So this is in the young. So we are the world's capital of heart attack in the young, by the way.
Oh, wow. Okay.
Yes. 25% of our heart attacks are aged less than 40. 50% of our heart attacks is aged less than 50.
Right.
Now, this doesn't happen in the West. In the West, there are perhaps only 10% people who have heart attacks less than 40. Not even 10%. It's 5%. It's a rarity.
Wow.
It's perhaps 10% less than age 50. So we're the world capital, and we understand why. But it's also, why do they succumb to a heart attack? So when you ask me, heart attack and cardiac arrest, the collapse that we see, a person suddenly passing away, suddenly standing and collapsing, is a cardiac arrest. A person with a heart attack still has time to get to the hospital and seek treatment.
Yeah.
But then we say, rush to the hospital as fast as possible and seek treatment as fast as possible, because when the artery to the heart gets blocked, every minute and every second counts because it's damaging the heart.
Right.
And if you don't get that artery open in the first 12 hours, then we've damaged the heart pretty badly.
And that's irreversible.
That's irreversible. That
Yes.
damage is irreversible.
Yeah.
That decreases pumping efficiency. It causes a lot of breathlessness, changes quality of life. And finally, it decreases the duration of life.
Right.
A damage to the heart attack. So we are therefore very, very insistent that a person gets to the hospital and gets the right treatment immediately. However, when we say, why do the young persons have a more fatal heart attack? It's because when blockages develop over a period of time, as can happen in the elderly, then heart has its own mechanisms also to protect itself.
Right.
And gradually develop, the heart forms collateral channels from other arteries. They take over, and when the artery blocks off suddenly, there's still channels which will take over and protect the heart from severe damage.
Right.
But in a young, when it happens, it's almost on a 20, 30, 40% blockage. And the heart hasn't had time to adjust itself through collateral circulation or alternative methodologies. And then the artery blocks to 100% suddenly. That suddenly stops circulation. There are no protective mechanisms in the heart. And suddenly, that is when the massive heart attack occurs. The massive heart attacks are the ones which 10% of the time suddenly go into a cardiac arrest. And that collapse is usually a heart attack when I say young adults.
Right.
Remember, in the children, I said it was a different mechanism.
Different reasons.
So what also happens, by the way, the heavy weightlifters, we think that weightlifting, gymming, all these are healthy situations, and that's why we say, isn't it, Triveni? We say, "Arey, wo to roz exercise karta tha, wo gym jata tha, wo to 200 kilogram utha leta tha." Then why did this happen?
Yeah.
And the reason is that the best form of exercise for the heart is the aerobic exercise. It's sustained, and you're not pushing. When you actually push the body to an extreme, and that can happen in extreme sports, that can actually happen with heavy weight lifting, etc. even a 20 or a 30% blockage can suddenly rupture. That block can suddenly rupture, we call it a plaque, and then clot starts getting stuck on it. Increased exercise causes certain factors in the blood to again create stickiness of the blood. Clot, the moment clot forms, the artery blocks and it's a heart attack. So it's like a pipe where suddenly it gets stuck, something gets stuck and then there's no circulation. That's what happens. So we say that the best form of exercises are not gymming, not heavy weightlifting, not extreme sports. And therefore we emphasize that any person who actually goes into gymming, heavy weightlifting, extreme sports, marathon running, trekking, mountain climbing, etc., should always have a cardiac checkup done prior to taking on the sports.
Wow. You've answered a lot of my questions, but I'm still going to, go back and break them down and ask you a few things again. It's quite ironic that you say that young people don't make it, but the over 60s do. You would think a young heart is better at adapting and dealing with it, but and somebody like 60-year-old will actually make it.
And I'll just again break it into some form of understanding. It's not that the young elderly can't have a large heart attack, but the death rates from a heart attack are higher in the younger because it's sudden and because it's happening on a heart where there were no severe blockages. And therefore the suddenness of the whole of a large artery getting blocked and damaging the heart is what leads to massive heart attacks. And if it's a large heart attack with a large area of damage, then the survival chances get lesser.
Right.
So it is the damage to the heart which is larger in the young. The elderly, because they develop blockages over a period of time, can therefore develop natural bypass circuits and natural circulation where suddenness of the blockage may not result in such massive heart attacks because they've got other compensatory arteries still supplying those areas because it all happened gradually over a period of time.
How fascinating the body adjusts.
The body is adjusting to it. And so the artery is getting blocked and it's got blocked to 70%, then it gets blocked to 80%, then it gets blocked to 90%, and the adjustment mechanisms and small vessels have taken over. And then from 90, if it goes to 100, the amount of heart muscle damage gets limited. While in a young, if from a 30%, which is nothing, it suddenly gets blocked to 100%, that's a massive damage because there are no collateral channels to take over.
And that's when your LVEF, the ejection fraction,
goes down tremendously. So the larger the damage to the heart, the greater the risk of not surviving, should we say. That's why, we always are very concerned. And the treatment of heart attack, of course, has evolved. We always say, open the artery up as fast as possible. The moment anyone experiences just discomfort, which is severe, sweating, ghabrat, etc., you say, don't even try and treat it yourself. Don't even try to figure out kya ho raha. Just get to the hospital, have an EKG. And through you, the most important messaging I would like to give is that often when a person has a heart attack, and especially young, get to the hospital, and they're told, oh, we must do an angioplasty straight away, we must put a stent straight away, your artery needs to be opened, it's immediate, it's now. Most of the young are thinking, but मैं तो ठीक था, मैं तो कल इतना चला हूँ, ये तो मेरे को ऐसे ही कह रहे हैं, ये तो शायद पैसे बनाना चाहते हैं. They actually waste the next half an hour to an hour trying to contact relatives, trying to contact other doctors, trying to figure out. And it's sometimes so distressing to see that he could die during that time of waiting. He could collapse, he could have a cardiac arrest, he damages his heart. Every second is damaging the heart, every minute is damaging the heart. And yet the decision making goes on for an hour and a half, till finally they all accept that it has to be done. By that time, because we say every second counts, and time is muscle, and muscle of heart is what keeps us alive, they sometimes damage their hearts to an extent that the survival gets limited. Everything gets.
I remember watching you on television a lot when you have these young deaths of celebrities, often, as you said, gymmers, very fit, exercising, etc., having heart attacks and not making it. Is it also the protein shakes and the supplements, etc., that they're taking? Is there any study around that?
When people go into gymming, and there's nothing wrong with gymming, I always say gyms have all forms of equipment. And therefore you can exercise and you can do aerobics, etc. But the gymming, when we talk about gymming, is of course the heavy weightlifting and bodybuilding. That's not heart healthy, because that's making you look good. In fact, it's heart dangerous in multiple ways to actually strain yourself to an extent. Smokers are the ones who on excessive straining can suddenly have a major heart attack, because their blood is already thick due to smoking. They've already developed minor blockages all over.
Right.
And severe stress can actually precipitate any. Remember, Hindi movies used to always revolve around कि वो पिताजी को बेटे ने या daughter ने कुछ किया और घर पहुंच के वो, when he gets stressed and when he gets tense and when he gets anxious, and then suddenly he'd clasp his chest
The stress,
and collapse.
Yeah.
Well, that is mental, but this is physical stress.
Right.
So yes, the relevance of anything which we talk about in the young and elderly and the gymming is also related to all the other things that they take to build up the muscles. And many of those are very harmful products for the heart. So all these supplements, as we say, so protein is fine, but there are many other mineral and non-mineral supplements
Right.
which gymmers take to artificially build up muscles. They cause effect on the kidneys, they cause effect on the heart, they actually precipitate heart attacks, and they are not great for. So again, that's another aspect that we really warn them about. This issue around gymming and people not understanding that heart health. See, for heart health, all that's required is brisk walking. Brisk walking
Is enough.
5 times a week of around 40 minutes, which is 200 minutes in a week. There was a recent study which said that more you walk, you can still improve your heart health. But the traditional, are conveying the simple message that even if you walk 200 minutes a week on a brisk pace,
It's enough.
we decrease our heart attack chances by 25%.
Right.
That's, there's not a single medicine
Yeah.
which will decrease the heart attack chances by the same without having any side effects. So that's the difference. And then anything beyond that, yes, we may be improving decreasing our chances of having a heart disease and heart attacks. Beyond that, maybe up to 60 minutes, up to 300 minutes. But beyond that, it's just weight loss. Beyond that, it's just fitness. Beyond that, it's just you're feeling good about how you can exercise, but not heart health.
But it's not detrimental if you walk more.
No, it's not detrimental if you walk more. You're absolutely right.
Yeah.
It's not detrimental if you walk more. You can improve your fitness, which maybe you can lose more weight. That's another aspect if you're really intent on losing weight because you're burning calories. There is more recent studies that perhaps men need more exercise than women to achieve the same amount of benefits. So men do need to walk more than the ladies, and therefore up to 350, 400 minutes has been recently. More science has been looking at it, saying how does exercise relate to heart health, and how can we improve heart health through exercise? You're absolutely right. The more you do, as long as it's aerobic exercises, so that's like cycling, that's like swimming, that's like brisk walking.
How it used to be naturally, as opposed to being a controlled environment called the gym. I'm not a gym fan. So, and I'm also not a very running fan. And I know this is probably controversial to say, but I think walking is also good for the knees. Running you would end up overusing your knees.
Yeah. No, you're absolutely right. Yeah. Yes, that's common sense as well. That you're actually having high impact exercise, it'll hurt your knees, and aerobics are never high impact. They're continuous, they're sustained. That's why swimming and cycling are not. They're moving the joints. Correct. But they're not moving them in a high impact exercise. They're moving them continuously in a very stable and smooth manner to get the maximum benefits for the whole of the body.
The Delhi pollution doesn't allow us to go out and exercise and walk. But what do you think of walking in a park vis-a-vis on a treadmill?
Both, either.
Okay.
Obviously, in the park, you're less stressed, should we say.
Oxytocin and
that's
all the
right,
nature
and everything,
and
calm, and there's lots of things to see. There's the birds somewhere, and there's everything, and there's somebody playing. So there's a lot of other things happening, as long as you walk at the speed which it is, and we always say the speed matters. You can't saunter around in the park for an hour and then say, "मैं exercise करके आ गया."
Yeah, chit chat and a stroll.
That's right. Or you can't be, one of the very funniest things, of course, which happens is there's a group of walkers.
Yes.
And they go out every morning.
That's
and
right.
I say, we walk every day. We've been walking for the last year.
They tick the box.
They tick the box. They have such a gup shop as they walk.
Yeah.
And the five of them being able to talk to each other. And for a common man, we say, what brisk walking means? And of course, brisk walking can be different for different individuals, isn't it? For a younger one, it could be different brisk walking.
Sure.
So what does really brisk walking mean? It says, if a person can actually not speak at all while walking, that means it's walking too fast.
Okay.
And if a person can have a huge conversation with a group of friends, that means he's not even walking enough.
So that's two extremes.
That's two extremes. So what is it? You should be able to speak only one sentence at a time.
Okay.
And that's the appropriate level of briskness for yourself.
Right.
मुश्किल से एक sentence आप बात कर सको.
Wow. So you don't necessarily have to be breathless to be brisk walking.
Correct.
Right?
Correct.
Is there a number for your heart rate that you should achieve?
Yes, there is a number, but the number is far more confusing, and I'll tell you why.
Okay.
Because of course it relates to your age. It's different for men and women, and then you get to 75% of that number. So what we say is heart rate minus your age, so 220 minus your age,
Okay.
and then 70% of that.
Okay.
So that's more confusing. So think that was the person 70, we have 220 minus the age, that gets you to 150, and 75% of 150 would fall somewhere around 120.
Right. Okay. So there's a formula.
So there's a formula, 75% of that.
Right.
But it's far more confusing, and that's why we say simple things are your level of walking. Because it's not the heart rate also. It's also your level at which you can walk where all your muscles are working. And that's what we want to achieve.
Right.
We certainly don't want to go beyond that heart rate. So those who push their heart rate to 150 are actually putting themselves again to the extreme risk.
Right.
So that's the best way.
But there's also conversation these days that just walking is not enough. I mean, that's helping your heart and your limbs, but you've got to do some muscles training as you age. 100%. Which again doesn't mean hit the gym and go crazy, right?
Triveni, you're so well informed. so correct. You're absolutely well informed. I guess you have to be, because you yourself are fit.
I don't know about that. It's all aesthetics, Dr. Seth. I wouldn't say I'm fit.
No, but you're right. Toning of muscles, light weights is important. As important as a heart-healthy exercise.
Right.
And that doesn't mean light weights. It actually always means, and you can do it by multiple methods. You can do it by weights, which is fine, but you can also do it even yoga. Yoga actually has, yogic exercises are those exercises which increase flexibility without putting too much strain on the joint, and actually are heart and body healthy.
Okay.
So in a way, every time, you'll see, if you take a trainer and he puts you through those warm-up exercises or gradually builds you up to a schedule,
those are yoga asanas.
Many of those are the ones which are coming from yoga. And in fact, I would even go to the extent of saying, yoga is not just those exercises, and yoga is not just those postures. Of course, they do build up a lot of balance, they do build up a lot of stability, core strength, exactly the ones which, as you grow older, one needs. But in a way, it also takes away a stress of life. It's spirituality coming in. And there's meditation.
Yeah.
And the science of yoga as a whole brings a stress relief and the right way to live. I think that's another important aspect. And I say stress relief is becoming more and more important now in the present day
absolutely.
of life.
And also I'm hearing this lack of sleep, which has become a very big factor for heart disease and general, not just mental well-being, but even physical, they're saying.
Yes.
Sleep deprivation.
Yeah, no, again, you brought out a very important risk factor which we tend to forget. And you have mentioned it, because this is a very greater realization of the past few years, is sleep. Sleep is an important aspect of well-being, but it's also, lack of sleep is an important factor for heart disease. And therefore, it is just becoming more and more important to actually have 7 to 8 hours of sleep. There was a time, I used to say, anybody who slept for more than 5 hours is probably wasting his time in life.
It's like Shah Rukh Khan, he's like 4 hours is enough for me. And they would say minimum 6 hours, but
I've changed that. I used to say that, and I would feel guilty if I'd slept for 6 hours. I'd feel guilty because I'd say 5-6 घंटे सोने की ज़रूरत ही नहीं है. There's so much to do in life. Why would you sleep? 6 घंटे. So I remember the time. I did whole my life worked around like that. And once I started sleeping 6 hours, I was feeling guilty. And of course, now I've upped it to 7 hours.
Good.
Without feeling guilty, which is not bad.
Yeah.
But I think everybody should understand that 7 hours of sleep is needed by the human body to then rejuvenate and be active, both brain and mind and physical, to be active for the next day. So I think we need to give our body and our heart some rest.
And even the other organs. Otherwise, we get up and we start eating and, everything's back. It's a machinery at the end of the day.
Absolutely.
So you have to rest it. Yeah. You've been talking a lot about men and women. This is an observation, but you're the expert. I noticed there are more men in their 40s, 50s having heart attacks compared to women in the same age group. Is that also, or is it just an observation?
No.
Okay.
And I want to again re-emphasize this point.
Right.
Women, it used to be thought that women were protected at a young age from having heart problems because of the hormones.
Right.
And that gradually, as everybody aged and beyond menopause, the women would actually have the same risk factors of having a heart attack as men. But that's no more the truth. Actually, in women, heart disease has increased, heart attacks have increased. Right. And heart disease has increased by the same proportion as has in men over the last 15 to 20 years. So that's the first.
Right.
Even in women, like we say, heart attacks are the most important cause of death. In men, even in women, heart attack are the most important cause of death, 6 times more than any women's cancer.
Really?
So we talk about, we talk about uterine cancers, when we talk about breast cancers in women, and we talk about awareness of that. And unfortunately, in that awareness is forgotten that the biggest cause is a heart attack and heart disease.
Hence my question, because we're not aware. We just don't think that women are having heart attacks.
Exactly. So we are far more concerned about women. And the reason we're concerned also about women, apart from the increase of heart disease, etc., is a few other factors. Women don't do as well as men after a heart attack. Women don't even are able to diagnose a heart attack. Women's symptoms are different for a heart attack. Women can just feel ghabrahat, can feel nausea, may not have the typical chest pain. I'm just not saying they can't. But more often, they may not have the typical symptoms of a heart attack.
Right.
They can it'll just be ghabrahat, nausea, vomiting, breathlessness. Acha nahi laga, theek nahi laga, and it'll just pass off and they would have had a silent heart attack. Women do, even for development of blockages, we call angina. When you walk briskly, you can get discomfort and then that something is happening and an artery is getting blocked. Well, women may not feel that at all. Again, for the same reason, it would be atypical. They could have arm pain here, they could just have a back pain. It's just because the nature of the arteries and the distribution and the size of the arteries in women are different.
Right.
So there's a whole science now looking at this very factors as to how women differ. Women tend to present late also after a heart attack because they don't have typical symptoms, so women can actually not recognize it till a few hours have gone by, and then they say, "Ab kuch theek nahi lag raha. Ye to pichle 7-8 ghante se kuch theek nahi." And then they come and it's already been 8 hours since the heart attack and they damage their hearts. That's again the reason why they don't do well. They don't do well even because the arteries are smaller. They don't do well better. They do. I mean, it is every procedure is life-saving as the same as men, so they actually have the same treatment. But the results are quite different. There is another aspect to it. Women tend to ignore their symptoms.
Right.
We often tell ladies, and again through your important podcast, I would actually say so, that women traditionally in our country have put men ahead, put family ahead, taking care of their family and the menfolk therefore disregarding some of the symptoms and saying, जाके टेस्ट करा लेंगे, कभी तो करा लेंगे, हो सके तो अच्छा ठीक है, ये तो अगले हफ्ते हो जाएगा, आज तो बहुत काम है, or he needs a checkup, or that taking care of their family and the menfolk, therefore disregarding some of the symptoms and saying, जाके टेस्ट करा लेंगे, कभी तो करा लेंगे, हो सके तो अच्छा ठीक है, ये तो अगले हफ्ते हो जाएगा, आज तो बहुत काम है, or he needs a checkup, or that my children's school matters and education matters, and आज बच्चों को पढ़ाना है.
Right.
So much of the symptoms are put in the background.
Right.
And when the tests are done, it becomes late. So again, diagnosis of many conditions is late. So we are, with these number of factors which affect women and heart disease, and the lack of realization that it is the biggest killer, we often emphasize that women are the most important people in this country. The families, the education, the health of every individual in the family relies on women.
Thank you for saying that.
क्या खाना है, कैसे पढ़ना है, every member, including including the lady's own parents and including the lady's spouse's parents, all become a responsibility of a woman.
Yeah.
And actually, the health of the nation relates to women.
Yeah.
And that's why I think we've got to put women much further ahead of men. Because maybe men's health would also change if women took
better care of themselves.
Then the men would be better aware and better treated. So I think
I would like to add another fact to that, I think, Dr. Seth, because women today are financially independent, they're working, and they're competing with men in workspaces. So that's adding more stress because they've not given up their domestic duties to do that. You see, so they've taken on more, and there's only that much any human can do. So you're constantly juggling. Where will it take a toll on? Your body.
So correct. I mean, you're right. It's like it's multiple stresses. Yes, you're right. There's the home, and that responsibility does not get shrunk for every working woman.
Correct.
Who has all the responsibility as work, has the same deadlines.
Yeah.
In fact, greater stress at work because there's always some form of a glass ceiling, which exists.
Yeah.
So there's a greater stress. There's competitiveness. And then there's trying to prove yourself. And then at home, that responsibility does not change, and that continues on.
Yeah.
And I think that's a huge thing. So sometimes that's why I think women are the backbone of the nation, because they are in multiple ways.
Yeah.
Multiple ways taking the how should we say, form the infrastructure of every aspect.
I always find that, and this is my observation, men who have daughters like you do are always more sensitive and understanding. And I would say, actually, you are the feminist. And we need more men like you to say those things, because people need to understand it's only a woman who can pop a child. She still has to go through that whilst managing her job and her promotions and her career. And at home, she's, and you said that they take on their husband's side of the family as well. So that doesn't go away. You're just juggling more. They keep adding more and more and more to see, how long she can go on. And she does, but at some point, the body. Yeah.
And that's why I think heart disease is a very important aspect of...
and I've seen women as well, doctor, say this is slightly off the heart topic.
Yeah.
Having high tempers because of high blood pressure. The stress becomes so enormous, then they have a stroke because they can't think that they could have high blood pressure.
Right. You're right. The observation is correct.
Yeah.
And women may not even get their blood pressure checked up.
Yeah.
Again.
Yeah.
घर का काम,
बच्चों
को देखना, husband को देखना, काम पे जाना, everything, and parents को देखना, in-laws को देखना. So and they may not even get their blood pressure checked. And again, silent killers: blood pressure, diabetes, cholesterol.
Cholesterol, yes.
That's why I say every person in this country को एक बार तो check कराना ही चाहिए in their lifetime, and early in their lifetime. I don't. The ones who got a family history of parents having had heart disease at a young age should invariably, by the age of 15 to 20, get cholesterol, BP,
The lipid.
sugar.
As early as 15 to 20?
As early as 15 to 20.
Wow,
By 20, they must get it done. And what does it take? It just takes an echocardiogram to rule out any congenital or genetic transmission of any heart disease. It takes a sugar test, and that's all GP related. That's not even cardiology related.
Correct.
Just go to a GP, he'll test your sugar, check your BP, and just check your lipid profile. Now that done, you know your risk factors. If there are none, you can continue to get these checked for every 5 years. But if there's something abnormal, then you're able to take care of yourself and advice of the doctor. What is it? Prevention of heart disease is no rocket science. Everyone knows the risk factors. Weight reduction, control of smoking, control of diabetes, control of blood pressure.
Yeah.
It's relatively less. You go to the West, you'll see lots of youngsters jogging in the park, cycling, jogging, etc. The reason for that is we're not proactive, we're counteractive. So all those people who are walking in the parks, etc., got diabetes, high blood pressure. They've been told by the doctors to exercise. They've been told by doctors to walk. Or they've got nothing else to do, so go for a saunter in the walk.
Right.
But the young ones aren't doing that. The young ones are looking at it. Just by single exercise. And again, through the messaging is very clear. Just by exercising, which we said, 40 minutes, 5 times a week, what happens? We lose weight. Blood pressure gets under control. Diabetes gets under control. Cholesterol gets under control.
Yeah.
We feel positive.
Yeah.
We feel energetic. Smoking stops. Then we because we are getting into fitness, we say, okay, less of alcohol. And suddenly you're taking away all the risk factors of heart disease by just single exercise.
Thank you for saying that, because I'm the only one on the track walking, and everybody looks at me. I'm like, because it's a taboo, I think, for young people. They're supposed to go to the gym, and I'm told who walks? I'm like, I do. It's quite nice to be in green, and fortunately, the pollution doesn't allow you. And this is very interesting when you mentioned that COVID and pollution, they have really exacerbated the heart problems.
Yeah, absolutely. Wow. From COVID, what we saw, we talked about that a lot, that COVID was not just a lung disease, it's also a heart disease. And but the biggest thing which came out of COVID was the realization that it affected the heart by causing heart attacks, it caused rhythm disorders, it caused weakening of the heart muscle that we call cardiomyopathy. But the preponderance or tendency to have a heart attack after COVID, because of thickening of the blood, did not remain just for that time when you had the COVID. We earlier used to think it lasts for 3 months, but science has told us that those who had COVID had 300% increase in 3 times, therefore 300%, 3 times increase in the chances of having a heart attack up to a year. But now we know it's up to 3 years. Wow. So that's why we say that COVID increased the heart attacks, because the effect continues to last. There was other factor, of course, as we know, the pollution, and we've been discussing this a lot nowadays. But we live in a polluted country, unfortunately. The best country in the world, I must say, India is, apart from the air we breathe, because we talk about it as a seasonal issue, and we say कि अब AQI 300 हो रहा है, 400 हो रहा है. Well, that's hazardous levels. But the best times of the year, when we don't even talk about, say, आज तो बड़ा अच्छा दिन है, even that is an unhealthy level by Western standards.
Absolutely.
So we're breathing polluted air 365 days a year.
Yeah.
And therefore you can understand that every bit of that 2.5 particle, including the carbon dioxide, nitrous oxide, and the 2.5 particles. The 2.5 particles are dangerous because they go into the bloodstream. It's well known to a known factor that they cause inflammation inside the arteries of the heart. They cause thickening of the blood, clots form, high blood pressure, coronary artery disease, and heart attacks is caused by air pollution, let alone the number of hundreds of disorders it causes, from lungs to brain to kidneys to skin to everything else. So there could be more than 100 diseases of air pollution caused, but one of the important aspects is the lung and heart disease that it causes.
Because it's all these toxins that we're inhaling even without knowing them.
Yes.
So mask up and air purifiers, but you have to get on. What do you do? It's not easy.
Absolutely.
So if one would have a typical symptom at home where you feel breathless or you feel sweating and you think it's a heart attack, and you've got time from home to hospital, what can we take? In the olden days, there used to be sorbitrate. I don't know if that is still
I'm glad you brought this up. I'm glad you brought the sorbitrate issue up.
Yeah.
It's so common to say, for a person feel uncomfortable and then say, but ghar mein to sorbitrate padi thi, or say, my relative used to take sorbitrate and he gave it to me and I took it. Actually, it's the worst thing you can do, take a sorbitrate. Okay. Even if it is a heart attack, any uncomfortable feeling, unless you're a known to have heart disease, known to have blockages, known to have coronary artery disease, and have been prescribed sorbitrate, it should not be taken. Because what sorbitrate does is suddenly drop the blood pressure in those who never taken it before, to the extent that a person can collapse and suddenly the blood pressure goes down and heart rate can even slow up.
Right.
So that is why the worst thing we find in our emergencies is people who have actually fainted or lowered their blood pressure due to other reasons like a faint and then been given sorbitrate to even make it much worse.
Yeah.
By the time they come here, they hardly got a blood pressure and we got to actually infuse lots of saline into them. Right. So sorbitrate should never be taken unless it's prescribed for a heart patient.
Right. What about a blood thinner?
Yeah, absolutely. That's the one which is to be taken. So aspirin, a dissolvable aspirin, is the best thing to take. And it's called soluble aspirin, 325 milligram.
Right.
You just actually chew it.
Okay.
And it gets absorbed straight away and starts acting within the next 10 minutes. It starts acting.
Right. Okay.
And starts thinning the blood. Now that is the most vital medicine one can take. Now there are 2 or 3 other medicines, but then none of those should be prescribed. The next thing is get to the hospital. But aspirin is a lifesaver, and aspirin is one medicine that we should always keep. It can't harm us, but in a heart attack, it can only benefit us.
And can we get it off the counter?
Yes, it is off the counter and it's just easily available to everyone. Okay. There are other medications, but that creates a lot of confusion. The common public just needs to understand no sorbitrate and aspirin.
Chew
it quickly. And you know the other aspect you asked about, and I know it's important that we're sitting at home and one of our relatives has a heart attack. But what if a relative collapses?
Right. Yes.
And we should know how to resuscitate that. So you know these visuals जो हमने देखे हैं इतने सारे, they are disturbing visuals when we see somebody's taking a video, somebody is dancing, and then the person collapses.
Just collapses. Yeah, there's a lot of that happening. Yeah.
And I just wonder कि जो video वाला था वो खींचता कैसे रहा? I mean, they should have been a part of resuscitating that person. We can save lives. We can save lives, and that's been well demonstrated that if public knows how to resuscitate, a life could have been saved. The other day I was teaching this on one of the interviews, and this is the basic life support. Basic life support is no rocket science again. It can be, watch a YouTube video and you will know what basic life support is. I'm telling everyone, learn basic life support, learn to resuscitate a collapsed person. That's cardiac arrest. A person I could be in a mall. I could be even at home and one of my relatives who has a heart problem can collapse. I need to know what to do rather than just say, ab kya kare?
That's CPR?
That's CPR, right. The basic CPR. The compression on the chest immediately.
Right.
While there's a system to it, and it's easily done, but every person should know basic CPR. We should be able to resuscitate. And it is very easy to perform. And everyone needs to go to the YouTube because it's not just anyone's life we may save.
Correct.
It could be even our own relative who may collapse in front of us and we could save a life.
Yeah. Which is why they say, which is what I read, that if you don't treat a cardiac arrest immediately, it could be fatal.
Exactly.
So that's where the CPR
That's where the CPR comes in. That starts off here from the first question. What is a cardiac arrest? What's a heart attack? The heart attack patient still has a time to get to the hospital and have treatment.
Correct.
The cardiac arrest patient has got only a few minutes. It's death unless resuscitated.
Right.
And that resuscitation has to be effective in the next few minutes for him to live.
Right.
And that's the bystander. We are the ones who can save that life.
Yeah.
It's not going to be the doctor in the hospital. It's not going to be the ambulance. It's never going to get there.
That's really...
We've got to do it right then and there. And that few minutes that the person who's collapsed has, is that the life that we got to save? Otherwise, the person's dead.
Thank you. I want to wrap up, but I want to ask you one last question. You pay a lot of emphasis to other factors like renal factors, like creatinine level and potassium. I've always noticed that you do that. What is the connection with the heart?
So it's also been known that heart disease outcomes get worse and worse if you have multivascular disease, which means if the blockages in the arteries to the brain or the legs, and if there's kidney disease. So that's the first step.
Right.
So for us, that matters. For us, it makes us more aggressive in the treatment. We want to be more careful for that patient. And we need to then cover all aspects to make sure that he has the best outcomes. Right. Whatever we're doing in terms of treatment is not just making the patient okay for that period of time and saying, I made you live or you survived, but also that we're giving you now, we knew that your lifespan is shortened, but what do we do to return you back a much longer lifespan? Every damage to the heart is shortening the life. Everything else which is happening is shortening of life. So all outcomes related to, you shouldn't be coming back to the hospital, you shouldn't have a second heart attack, you should live well, and you should live longer and get your life back. So then when we do that, then we got to look at all those factors. Many of the medicines that we use also change the kidney function and the potassium. And they're all beneficial to the heart and they're all beneficial to the kidneys at the same time.
Right.
Yet they change the electrolyte imbalance. And if we miss that, then it can be fatal to a patient or can become very serious to the patient. All these electrolyte imbalances also affect the heart rhythm. And that is why it's our responsibility that as we improve outcomes to make sure every aspect of the human body, as much as we know of the human body, which is still hugely minuscule,
right.
And that is why we continue to see advances every few years to say, ab to aur pata chal gaya, ab to aur cheezein pata chal gayi, ab to aur hum kar sakte hain, is always that you look at a person as a whole because you gave him the best outcomes and on a longer period of time.
This is why I say you're not just a good cardiologist, but you're a very well-rounded physician. Because I think you're one of the rare ones who will even talk about neuro and even gastro. Most people will just focus only on the heart if you're a cardiologist and maybe diabetes. But you will literally go even to the hepatic ones, the SGOT, SGPT. You're very particular. And
Thank you.
Yeah, no,
Thank
brilliant.
You,
Thank you for sparing time. I know you've got to attend to your patients. But there are 2 fun facts that I would love to share with my viewers, if I may, about you. A little birdie tells me that when Dr. Seth gets home, which is almost midnight most days because his procedures and OPD runs almost till 11 o'clock at night, he warms up his dinner. So I think a lot of us, Dr. Seth, could take a leaf of humility from your playbook of life. When someone of his stature can do this, I don't see why the rest of us need to strut around like we've arrived. And the second one, which is my favorite, whenever you pay Dr. Seth a compliment, he always blushes, as he's doing now. So thank you. Oh, and as we wrap up, I forgot a very, very important technical question, Dr. Seth. Are your patients recognizing you in your new avatar with your beard and hairstyle?
Yeah. It's been the most dramatic change in my life.
Yeah.
I've never kept a beard.
And you've never had short hair.
Yeah, I never had short hair. I've always had long hair.
Yeah.
And friends, in fact, I was at various meetings where they've taken some time to recognize.
Right.
I bumped into people who just didn't even look at me.
Yeah, that's what I'm saying. It's like a makeover.
Correct. They didn't look at me.
Yeah.
And I said, hi. And they hadn't looked at me. And they just sort of moved away. But I think there's always time to try.
Why not?
Most people do compliment. I guess they compliment me because they have no option apart from saying "acha lag raha hai," because I don't think anybody says "bada kharab lag raha hai." But I know. It's been a change. I think I'm liking it for the moment.
Yeah. I think you look dapper.